What advice do you have for folks that are just getting started in this space to think about diversifying the school workforce and also for centering equity?
So one, I think just get started. Any place you start is okay. So if people tell you it's not, ignore it. But I think the first place is one to create a shared goal, even if it's just shared within the education system, right? We want to have a diverse school health workforce, and we want to come and work in partnership to see how that's going to happen. One of the key principles is leadership. Folks who really center youth wellness. I have to bring a lot of partners in to create that. It's going to take time to get out, and so having patience and having those short, medium, and long-term goals so you can chart your success along the way. The second big piece is really talking to the youth. And youth and family, understanding what they want and creating the partnerships necessary to make that happen. The next piece I would do is gather some sort of data. It doesn't need to be perfect, it doesn't need to be beautiful, but often the starkness of data will demonstrate where to start. So if you are in a community that's 86% Indigenous and you have no Indigenous providers, you're like, oh, well, that's a flag and we probably need to start there. That is where you want to get to in terms of diversity. And understanding that means understanding who's at your table right now, and looking at your policies and practices to see what's hindering that. Equity, on the other hand, for me, really has to focus on outcomes. Data for outcomes that are defined both by the school system, the health system, the youth, like everyone should see themselves in those outcomes, but looking at them and being able to disaggregate them. So we really need to understand who the community is and disaggregate it. I would say you have to create a safe space too. Everyone's learning together, and having the capacity to talk through things, question things as you come up with this broader goal is going to be important.
So building on that, then what are some of those promising best practices, promising practices that we're seeing in schools as they diversify their school health workforce, and lessons that can be applied to other schools too?
Some of the promising practices are having the providers sit down with the educators. So really helping to understand, and so being able to partner with people who are doing creative things. So the response is, then what do I do? Well, you know, let's look at some of the other work that's going on with social emotional learning, with school discipline reform, with looking at restorative justice, like being able to bring tools that can help with that. What are the gaps? What are the needs? There's a lot. There's legislation and policy around screening kids. And so screening them for health needs, be it for substance use or mental health or other concerns, then shows there's a need, and then you can get folks to recognize that you need school health professionals while also helping to serve the kids. So not only is it benefiting the kids because you're screening to see if there's an issue, but it's being able to demonstrate that you have a need and this need to be fulfilled, and the community can't fulfill it. I think one thing people often go to is telehealth. There have been really good studies that telehealth can be effective, good studies that avatars can be effective. You can get a broader, diverse set of providers, but you gotta make sure the right ones that kids actually want, that they're developmentally appropriate. For all of the best practices, I will say they've all talked to community in one way or the other. I'm hearing so many things that people are like, we're just gonna put people in the schools. And you're like, you do that, but if it's not appropriate, that's still not gonna be helpful. And so that community engagement really helps with that piece and that transition.
Are there specific resources or websites or materials that you recommend for school health workforce as they're starting or wherever they might be on this journey to diversify, but also, as you say, to be thinking more intentionally about equity in the workplace?
I would start with the federal government for two reasons. One, because they've had a lot of experience in this space, and I want to be clear that we don't have a perfectly diversified workforce. So they haven't ended it, but they have thought through some of the nuts and bolts of what it takes to do a scholarship and loan repayment program. The nice thing about some of the federal programs is they have to review them. And so you often can get lessons learned on what to do. Medicaid can be complicated, so you want to make sure you have those policies and procedures in place to make that work. And so for that, I would actually look to some of the great work that Healthy Schools Campaign has done. And even as you think it through for Medicaid, there may be other healthcare pots of money, like SAMHSA, the Substance Abuse Mental Health Services Administration, or HRSA, the Health Resources Services Administration. But even looking as states think about what programming they want to put together, there are people doing great work from K through 12. There are some great pathway programs out there that people can emulate. The linkage policies. The policies, if you graduate from high school, we will create a path for you. And some of those policies look like having a path to community college, and then a path from community college to four-year college, having a path four-year college to nursing school or medical school. If we have schools that are equitably educating and inspiring and providing support for our students, we will have that pathway pipeline. That's where some of the SEL training, some of the discipline training, we can work in partnership to create those relationships that create a better school environment. Anyone should be able to go to any career they want to, and the fact that that hasn't happened in the healthcare workforce should give us pause, and we need to regroup. Schools have a unique role. They are planting the seeds. One of the challenges is really rethinking what does our school environment look like so it's holding kids and really helping them to thrive, so they're ready for wherever they want to go and that they can actually thrive.